detail the recent trends in infertility, the success stories, and the videos of some of the karmas which are routinely practiced in our department. So firstly, need assessment is very important before starting any presentation as to why this topic is essential and why this topic needs to be addressed seriously and with utmost care. So this is the report which was published in 2023, and this was the report published by WHO, which said that 17.5% of the adult population, that is roughly 1 in 6 worldwide, has this problem of infertility, which shows the urgency and the need why this topic needs to be addressed with utmost sincerity and seriousness. So the lifetime prevalence according to this report was 17.8% in high income countries and 16.5% in low and middle income countries. That is, there is no as to restriction or no, we cannot say that this particular group of country or this particular socio-economic status is more prone for infertility. We see that it is equally at risk and rising in all parts of the globe. So according to the Director General of WHO, the report was published which says that it is of utmost importance to address this issue of infertility, and that the utmost truth is that infertility does not discriminate, which means that it is prevalent and it is common and it is growing up in all the sections and all the countries of the nation. In India, if we want to highlight, the rate of infertility has risen till date up to around 13 to 15%, which is indeed a very grave concern why we need to address this issue very seriously. And infertility, as we all know, that it doesn't affect a particular individual. It affects the entire family, and it not only affects the physical health, but the mental health, emotional health of the couple and the entire family and the society at large. Hence, it needs to be addressed very seriously and holistically. So here comes the role of Ayurveda. Now we all know that Ayurveda has, the world is looking up to Ayurveda with great expectations in most of the conditions wherein the Western world has no answer or no specific answer, infertility being one of them. There is a common principle which is governed while managing infertility according to modern science. But Ayurveda has more modalities and more number of options of dealing patients with infertility. Hence, it is very important, and why role of Ayurveda is of immense importance in the treatment of infertility. So what Ayurveda has to say? So as we know, the basic principle that governs around Vandhyatva is the concept or the principle of Garbha Sambhav Samagri, which says that Dhruvam Chaturunam Sannidhyat Garbha Syat Vidhi Purvakaha Rutu Kshetra Ambu Bijanam Samagrayad Ankuradhyatha. That means the importance of these concepts, these principles, that is Rutu. Rutu means the menstrual cycle. Kshetra, that is the entire reproductive tract of male as well as female. Ambu, which is the portion or the nutritional factor. And Bija, that is the male and the female. Bija, that is the sperm and the ovum, are the important factors which govern the entire principle, entire management, and the entire etiology of infertility. So there has to be one of these factors responsible why the couple is unable to conceive. Hence, this principle, we all know, it is commonly considered as one of the basic principles for the cause and the management of infertility. Rutu, as we all know, is the menstrual cycle. If there is any defect in the menstrual cycle, in the hypothalamo-pituitary-ovarian axis, it may be in one or more factors of the axis. If there is any deformity, anatomical, physiological, any defect, then we all know that it leads to infertility. If this is normal, there may be some cause in the anatomical part, that is the reproductive tract. It may be in the male or it may be in the female. There may be some anatomical defect, which is rather rare, but the pathologies are very common in the causation of this condition. Now, there may be some defect in the cervix or vagina. there may be some infective pathology, there may be some defect in the uterus per se, there may be some block or space occupying lesion or pathology in the fallopian tube, or there may be some defect in the ovary. So these are the kshetra which may be the factor. In that case, when we diagnose the kshetra to be a problem, we need to treat it according to the pathological or the condition as a cause of infertility. Nutrition. Nutrition, as we all know, is one of the conditions of infertility. There are several supplements which are being prescribed by the modern gynecologist for the management of the infertile couples. Bija, we all know that defective sperm, which we come to know by doing semen analysis, or some defect in the ovum, or anything related to semen or the sperm and ovum, come under this entity of Bija Dushti. So these are the basic concepts, or these are the basic factors which are responsible for infertility. We will be dealing with them in detail in the slides to come. Now, other hetus which are mentioned in other parts or the other sanhitas or other references are as follows. See what happens. It is very important to look into the principles and the concepts which are mentioned in Ayurveda, because Ayurveda has not mentioned pinpoint indications, pinpoint diagnosis, or pinpoint causes. It is all mentioned in sutra swarup. So we need to understand the sutra, the meaning of that particular sutra. Only then we will be able to know and understand Ayurveda, and only then we will be able to use its principles. Sperm or defect in ovum. Anything pertaining to these defects can be considered to be under the entity of Bijansha Dushti. Second is Sushrutacharya, as we all know, is Shalya Pradhan. So Sushruta has mentioned some defects which are related to infertility or some of the causes of infertility under the heading of Yoni Vyapad. We all know that Shandi Yoni or Suchimukhi Yoni are the conditions which we practically see as being one of the causes. So these are mentioned by Sushruta. Vandhya is also mentioned by Sushrut. And as we all know, Artava, Sushruta has played great emphasis and has detailed the topic of Stroto Dushti or Lakshana of Vidya Srotasas in detail. While mentioning that, he has mentioned that if Artavaha Srota is Vidya or is injured, or there is any trauma to Artavaha Srota, then Vandhya, he said, becomes one of the Lakshanas. So here he has mentioned Vandhya as Artavaha Sroto Vidya Lakshana. Kashyapa has mentioned the Lakshana or the different causes and management of infertility under the heading of Jataharini, Pushpagni, Sphalita Mutratva Roga, and Panchakarma Upadravas. So under these headings, we can see the different factors or the different causes, and the patients that we see these days can be correlated to some of them mentioned by Kashyapas. Harita has mentioned different conditions such as Ajata Rajasa, Balayastha, that is different types of infertility, we can say. Harita has mentioned some of them being primary infertility, some of them having the signs and symptoms of secondary infertility, some of them related to the nutritional deficiency, some of them related to early conception, that is if the girl conceives at a younger age, then she is unable to conceive. That reference we can see under the different types of Vandhyas mentioned by Harita. So Dhatukshay also comes under the entity of nutritional deficiency. Bhela has mentioned Bija Dosha, Apatya, and Vegadharana as one of the causes, Yoni Dosha and Vayu as one of the causes of infertility. Others include Artava Dushti. We can see the references or the mentioning of Artava Dushti at various tenses and various places in Ayurvedic Sanhitas. Garbha Sambhav Samagri, as we have already discussed. Manasik Bhav, we all know that not only the physical but mental causes or mental stress and strain plays a pivotal role in the causation of infertility. So our acharyas have also mentioned that manasik bhava, that is shok, krodha, shok, whatever the conditions lead to manasik dushti, also play an important role in different conditions, including infertility. Atibala, Vruddha, Shudha, Nyubja, Parshva, Yoni Arsha also have been mentioned. And most of these conditions are said can be considered as Vata Pradhana Hetu. So most of the conditions and most of the hetus of Vandhyatva fall under Vata Pradhanya Dushti. Hence, as we will see in the slides to come, the basic principle of management comes as Vata Chikitsa. Vata Pradhana Chikitsa is one of the major aspects of management of infertility in male as well as female. Now here comes one of the references of Charak Sanhita, wherein he has said that how or when do we see that related to infertility, why and when is the couple unable to conceive. Yoni pradoshaj, manaso abhitap, that is physical yoni related issues, any pathologies related to yoni means not only vagina, it refers to the reproductive tract. Manasobighat, that is mental factors. Shukra, Asruk related, that is sperm related or the male factors. Asruk is Artav related. Ahar and Vihar, Doshat. So any of these factors can be responsible for Vandhyatva. Akala Yoga Bala. So again, if these are the conditions, na chirata, that is the fetus or the garbha is unable to stay in the reproductive tract or in the uterus for long. If there are any one of these conditions is there, then it leads to habitual abortion, or it can be miscarriage or any of the early trimester abortions. So the references are not only related to primary infertility, but they are also related to the secondary infertility and bad obstetric history. Types of Vandhyata, as we all know, according to Harita, Kaka Vandhya, that is, this is the reference of secondary infertility. Anapatya, that is primary infertility. Garbhasravi is early trimester abortions. You can say it is miscarriages. Mruta Vatsa, that is stillbirth, deliveries. And Kshayajanya, that is in case of nutritional deficiencies. So these are the types of Vandhyas which are mentioned by Harita. Now coming to the modern aspect, the infertility according to modern science is referred to as primary as well as secondary. Primary is unable to conceive even once. Secondary is once the patient has conceived and after that she is unable to conceive after regular intercourse for more than a year, the patient is unable to conceive. Then there are male as well as female factors. Now both male and female factors are, the defects may be either anatomical or physiological or psychological or pathological. This can be common in male as well as female. So in any of these conditions, if it is there is nothing beyond these things. It has to be anatomical, physiological, psychological, or pathological. Sometimes the term used is idiopathic. That means no particular cause is there. But this term is referred to in modern science. When we go in depth and when we take the detailed history of the patient and do a detailed clinical examination according to Ayurveda, Srotas Parikshan, and all the detailed examination, we definitely find some cause or the other. So this is the causes or the etiological factors according to modern science. Coming to this percentage, we see that the male factor contributes to 30%, female 30%, both in 10%, unexplained in 25%, and others 5%. Now, as already discussed, the possible causes of infertility can be anywhere in this reproductive tract. It can be in the vagina in the form of some infection or in some of the anatomical defects which are rather rare, but infective pathologies or some pH alteration may be there here. Then there may be some defect in the cervical, external or internal os. There may be some pinpoint os or cervical length may be less. there may be some space occupying lesions in the uterus, or there may be some anatomical defects in the uterus, which may be one of the factors. And another important factors is the tubal defect. It may be patency of the tube, which may be in the form of some past infections such as tuberculosis, or there may be some other pathology, or some corneal block may be there, which is diagnosed doing hysterosalpingiography, or there may be some defect in the ovaries in the form of defects in the ovary, or some polycystic ovarian conditions, or premature aging of the ovaries, bulky ovaries, or some cystic lesions of the ovaries. So there is some pathology in this reproductive tract in female. Other factors in female, that is tubal factors, contribute to 30%, ovulatory dysfunction cause to 35%, and diminishing ovarian reserve is 20%, and endometriosis 10%. Causes in male, we can say that some of the common causes in male are immunological factors, obstructive disorders, sperm defects, unexplained infertility, aging, and ejaculation dysfunctions. Now, percentages wise, if we see, then there are immunological factors contributing to 5%. Hypogonadism, varicocele is one of the major causes which we regularly see in the patients, which is 17%. Systemic diseases, sexual factors, urogenital infections, undescended testes, and unexplained contribute to 34%. So another type of differentiation maybe, or another form of the causes can be pre-testicular factors, post-testicular, testicular, and semen related. So dietary nutrients deficiency, diseases such as diabetes, liver, fatty liver, or other conditions. Then environmental issues are also common, which may be elemental, smoking, radiations, alcoholism, age and obesity, varicocele, sexually transmitted diseases, and dietary nutrient deficiency. These are other factors which we see as one of the male infertility or male factors responsible for couple infertility. So in a nutshell, male factors can be shared as genetic disorders, diabetes, ejaculation problems, varicoceles, exposure to heat, toxins, genetic factors and DNA damage, lifestyle, semen disorders, bacterial or viral infections, steroids, trauma, and undescended testes. In female, ovarian factors, uterine, cervical, vaginal, and systemic factors. And the couple causes include sedentary lifestyle, which is very, very common because of the work pattern, work schedules that we see in different sectors, working sectors, unhealthy diet, smoking, drug abuse, alcohol use, lack of sleep because of different work schedules, and stress and disharmony is one of the factors which is usually ruled out while we treat and while we manage the patients of infertility. One should not restrict to just the diagnosis and only clinical examination. One should also be a good listener, and counseling plays a very, very important role because it is not something which is very, very objective. It is something which is subjective as well. Hence, one should always emphasize on, and one should always keep in mind this factor of disharmony, which is coming up in huge numbers in the patients of infertility. So counseling and being a good listener is a very, very important aspect in the management of couple infertility. So we all know that this is the circadian rhythm which is disturbed. And when we say that there is the lifestyle is disturbed, we see that this circadian rhythm is disturbed, and because of some people working in some call centers or some IT sectors or even healthcare professionals, there is no particular time or the schedule is disturbed. And this circadian rhythm, when it is disturbed, it leads to various conditions, not only infertility, it causes various other conditions, including infertility. Hence, again, I would like to emphasize that while treating such patients, which we entitle under lifestyle disorders, one should always stress on counseling and proper history taking. So time is very important while handling these patients and while managing these patients. Sometimes mere counseling is sufficient to treat many problems, including this one. So the diagnosis is based on history taking, ovulation testing. Now, these are the list of investigations which we usually do. One more thing which I have noticed is that sometimes what happens when patient comes to us for the management of infertility, at the single visit, the doctors give them a big list of investigations to be done. I think in my practice, I feel that one should always follow a stepwise pattern while prescribing investigations to the patient. Rather than rushing to all investigations at one shot, one should follow step-by-step pattern. One should always see that what are the clinical symptoms, what is the history of the patient, what is the lifestyle of the patient. Depending on that, always start with the basic investigation. Sometimes you get the diagnosis only in the basic investigation. So you don't need to progress to the higher investigations. Once our major objective is to diagnose the problem. If it gets diagnosed at the earlier stages, you need not go to the other stage of investigation. So one should always follow a step-by-step or the ladder pattern, as I call it, ladder pattern of investigations. So one should always start with the basics. Say for we can, if the patient seems to be nutritionally deficit, we can go for a CBC. If there is a disturbed menstrual cycle, you can always go for a sonography first. Then you can go for a hormone profile. If you see that the male factor, you can suspect some male pathology or the lifestyle is such, then you can always go with the male investigations first. So this way you can gradually progress with the investigation rather than rushing to all investigations at one shot. So history of the patient, ovulation testing, if you see that the menstrual pattern is irregular, there is irregular menses, you see the signs and symptoms of PCOD, then obviously we have to go for sonography first and ovulation testing. Prolactin levels need to be tested. Everything is normal. If you see all the investigation basics, they are normal, then you can always think of hysterosalpingography. If the patient gives you of history of COX, which should be always ruled out while taking the history, then hysterosalpingiography needs to be done to rule out any pathology in the or the space occupying lesion in the reproductive tract. Ovarian reserve testing can take a backseat. It can be done in the later stages, provided the age of the patient is appropriate. If the patient is coming to you in, say, for late 30s or 40s, then ovarian reserve has to be tested. Other hormones testing, imaging tests, hysteroscopy, laparoscopy can be done at later stages. Genetic testing, something which has to be ruled out even in the later stages, such as if there is late conception, if there is a history of habitual abortion, or if the previous pregnancy of the patient has any genetic defects, then this genetic testing needs to be done. So most important is clinical examination and being a good listener. Semen analysis, couple blood group and cross match, CBC and Doppler studies. So basis of Ayurvedic treatment are, one should always stick to the basic principles or siddhanta of Ayurveda while treating any condition, including this one. So here, what are the basic principles which need to be kept in mind, or which are the basic siddhantas? Tridosh, there's a spell mistake. Tridosh siddhant, Saptadhatu, Trimala siddhant, Samanya Vishesh siddhant, Shatkriya Kal, Panchabhautik Chikitsa, and Prakriti, according to Prakriti. So what are the principles of management or treatment? It can be Aushadhi Chikitsa, Shalyakarma Chikitsa. Aushadhi may be in the form of Shaman or Shodhan. Shaman, Dravyaushadhi or Rasaushadhi, and Shodhan may be in the form of Panchakarma. So one of the major or the main concern or the number of patients, more number of patients we see are those of PCOS, polycystic ovarian syndrome. So the principles which we need to keep in mind while managing these patients is the concept of Agnimandya, Avrittavat, Lekhan Chikitsa needs to be done over here, Agni Deepan and Pachan. Now Lekhan Chikitsa may be in the form of dravya such as Kuberaksha or Lata Karanja, or in the form of Lekhan Basti. Agni Deepan Chikitsa and Pachan in the form of dravya such as Arogyavardhini, Chitrakadivati, or in the form of Hingashtak Churna. And dosha pachan, the same thing, arogyavardhini and trikatu can be used for dosha pachan in these patients. So the concept of Agni, Am, Mala, Strotasas and focusing or on Garbhavavastha and Garbhapata Hetu. So Chikitsa should be based on Nidana Parivarjan, Saumanasya, that is the treatment of psychological conditions or mental stress and strain, and Panchakarma as per Prakriti. So as per Prakriti and as per Dosha Bahulya in that particular patient is very important before prescribing even drugs like Arogya Vardhini. Sometimes we have seen that the patient, depending on the Prakriti of the patient, some patient which has given results for one particular condition has led to different side effects in the other patients. Why? Because the Prakriti was different, and hence one particular medicine which was very suitable to one patient was not at all suited to the other group of patients. Hence, Prakriti of the patient should always be considered while prescribing even the basic medicines of Ayurveda. Shatkriya Kal. Now in PCOD, there are different stages of PCOD. So depending on that, we can see that effective lifestyle leads to Sanchay. If this Sanchay Avastha is not treated properly, it goes to Prakop Avastha. Now, Sanchay Avastha is not very much visible in the form of signs and symptoms. It can be visible in the form of Shaithilya or dullness or a little bit of heaviness in weight or gaining weight. So this can be Sanchay Avastha, or Amajanya Lakshana can be seen in the Sanchay Avastha. If untreated, it leads to Prakop Avastha, which can be manifested in the form of formation of cysts. If this is untreated, it leads to Prasar Avastha, which can be manifested in the form of systemic changes in the body. Sthana Sanshray can be seen in the form of defects in ovarian volume and metabolic defects. Vyakti and Bhed can be manifested as proper diagnosis of infertility, pelvic pain, anxiety, depression, hair loss, oily skin breakouts, acne. So these are the stages for your reference. If you, whatever stage the patient comes in, you need to consider that particular stage of Shatkriyakal and treat the patient accordingly. One form of therapy may not be suited for one particular stage, such as if the patient comes to you in the Sanchay Avastha, it is readily or it is comparatively easy to treat such patients. You can give Deepan Pachan Chikitsa, you can have a Basti Chikitsa, and the patient may show you symptoms of relief. If the patient comes to you in Prakop Avastha, the duration of treatment may be a bit long, some medicines may be more, the dosage may be increased, and no number of therapies or panchakarma may be required in these patients. Systemic changes are there. Again, you know that it may take around 3 months, 6 months for the patient to get relief. Systemic changes take longer time. So the sooner you diagnose the patient, the sooner the patient comes to you, the better results you will get. Even in modern science, when we will see in the later slides, the key of management of infertility is early detection and early therapy. They say that when the patient comes to you as early and in the early stages of infertility, the success rate of IVF or various therapies which modern science prescribes, the result is better. Management, it is in the form of Svedana, Udvartan, Basti, that is Yoga Basti, Kal Basti, Lekhan Basti. Depending on the prakriti of the patient, the stage of the patient, the stage of the disease, we need to prescribe this particular Panchakarma. Virechan and yogic management in the form of pranayam, anulom, vilom, and different others pranayam are really effective in the management. We have seen patients and treated with yogic management and other management therapies also. Definitely, we get very good results if we incorporate yogic management in our therapy. Now, an ovulatory cycle as one of the factors of infertility, we have successfully treated using Shatapushpa Taila Basti. So how the Shatapushpa Taila Basti works? As we all know, Shatapushpa is Katu Tikta Rasatmak, Ushna Virya, Kapha Vatagna, and Agni Vardhan Gunatmak. Also, it has Am Pachan property, and thus Rasa Dhatu Shuddhi is accomplished. and proper rasa dhatu formation leads to proper upadhatu of rasa formation. Hence, artav is maintained properly, and artava nishkraman and vatanuloman guna also contributes to the uh, anovulatory cycle, reduction in anovulatory cycle. Shatapushpa, by its phytoestrogenic properties, brings down the level of insulin in the body and restores the cellular imbalance that is the major cause of PCOS. Basti, for kalpas for panchakarma, for basti, we usually use dashmul, ajmoda, we add ajmoda as prakshep dravya, trifala, bhadra nimba kulatha, kashmari kutaj, manjishtha, lodra, shatapushpa, and bala for different patients and different pathologies. These are the drugs which are used in different quantities and proportions in variety of patients with different causes of infertility. Vaman Virechan, the drugs which we use for Snehan is Panchatikta Grita, Goghrita. If the patient is unable to take Tikta Grita or Panchatikta Grit, Goghrita is given. Shatavari Ghrita or Yashti Madhu Grit is advised. Uttar Basti is also given in the patients where all the factors are normal, still the patient is unable to conceive. Then we go for Uttar Basti. The procedure video we will see later on. And the drugs which are used are Falagrit, Sharatel, Til, Trifala oil, and Bala oil. In again different patterns of uterus and the different pathologies or the different conditions, we use different types of medications for Uttar Basti. For Pichu, now as I said that there are other various factors. One of them is the infection or the pathological factors. So if there is any erosion or any infection in the reproductive tract, mostly in the vaginal wall or in the cervix, we use Pichu Chikitsa in the form of Jati. Jatyadi tel Pichu is used. Karanja tel gives very good results if the samprapti or the condition looks like kafaj. Now, how to differentiate whether it is a kafaj samprapti locally or local pathology is pitta pradhan or vata pradhan? We can easily diagnose it just by having an insight by doing per speculum examination. If the patient comes to you, always consider or always listen carefully what I said earlier. Listening is very important. Whatever is the first complaint of the patient, that gives you an idea about the chronicity and the intensity of the problem. If the patient comes to you and tells you that she is having more abdominal pain, lower abdominal pain and low backache, immediately you can have a little bit idea that it is a vata samprapti. If the patient tells you that there is burning type of pain vaginally, you can suspect a pitta samprapti. If there is more profuse discharge and itching related conditions, you can suspect it is kafaj. If you look at the cervix, if there is redness, more of redness, burning, severe vaginitis, strawberry-like appearance, you can suspect it is a pitta samprapti. In such conditions, you can use a Shatadhautagrita Pichu and Panchavalkal Yoni Dhavan. Also, Nimba is very good in Pittach conditions. If you see that there is more of tenderness, more of pain, and Tanu discharge or a little bit discharge is there, you can suspect it is a Vata samprapti. You can use Bala or Jati in this condition. So depending on the pathology, depending on the picture while doing PSPV examination, you have to decide about the what type of drug is to be used. Every drug may not be, if there is a pitta samprapti, more of burning, more of redness is there. And if you do a karanja tel, it will aggravate the pain. Patient winces in pain in such conditions. So whereas if there is burning, more of pitta samprapti and you apply Shatadhaut growth, then and then the patient says she is feeling better, because it is a colloidal solution and hence it immediately gives relief to the patient. So one should always keep in mind as to what type of drugs are to be used in what type of sampraptis. Dhupan is also given to the patients. The drugs used for Dhupan are Aguru, Trifala, Ajmoda, Nimba, Gugulu, Haridra, Musta and Grit. Shatapushpa, Shatavari oil is used meticulously in anovulatory cycle or PCOD, or in patients where no specific cause can be ruled out on the pathological lists, investigation list. We always use Shatapushpa, Shatavari oil for Basti. So Shatapushpa having Tikshna Gun, it has quick absorption, it stimulates the ovarian function. Lekhan Good helps in the rupture of the dominant follicle which is needed for ovulation, and Vata Har property. As I already said that most of the treatment should revolve around Samprapti Bhanga of Vata or the treatment of Vata. So there also Shatapushpa helps. So Rutu Pravartan, Artav and Bijotsarga can be inferred as ovulation. And Tela, if when the medium is oil, as we all know, oil is Snigdha, Ushna Guna and Yoni Vishodhan Karma. So hence, Vigurata of Apan Vayu, which is mainly involved in the Samprapti of Vandhyatva, is taken care of. Eranda Muladi Basti, the ingredients are Eranda, Rasna, Guruchi, Ashwagandha, Atibala, Aragvat, Punarnava, Madanfal and Devdaru. This also is used meticulously, and it is used liberally in the patients with an ovulatory cycle and the conditions wherein Vata Dushti is there. Lekhan Basti, when the patient is obese, BMI is more, Lekhan Basti is given, which regulates the menstruation, decreases body weight, causes expansion of the follicle, and improves the ovulatory process. Along with whatever Basti is given, it is always given Sneha Svedottar, Snehan and Svedan, and is followed by Basti. And even in Lekhan Basti, Snehan Svedan is there. And after Snehan Svedan, Udvartan is given to the patient. Now, what Udvartan does in patients with obesity and PCOD related obesity? Effectively mobilizes the stored fat. It mutilates and liquefies the fat so that it is available for disposal from the system. So Udvartan has drugs have Ushna Gunatma potency, Rukshata is there, then Lekhana, that is scrapping of Dhatu and Mala after initial absorption of moisture, and due to rubbing and scrubbing with pressure in the process of Udvartana, the drug and Udvartan both effectively work on dyslipidemia. So this is how Udvartan Chikitsa works in the obesity-related PCOD. Kashmari Kutaj Basti we use in patients which have the patients who have torch infection or continuous infective pathology. If we suspect such conditions, then we give Kashmari Kutaj Basti. So Kashmarya having Guru Gun has the action of Brihana, which helps in the growth of the follicle, and Ushna Virya along with Rechan Karma helps for the follicle to rupture, which is essential factor for ovulation to occur. And Kutaja having Laghu Ruksha Gun along with Lekhan Karma helps the ovum, which is surrounded by corona radiata, to escape out of the Graafian follicle, and hence the process of rupture takes place. So anovulatory factors, anovulatory conditions, Kashmari Kutaj Basti is given to the patients. Now coming to male infertility, there are several factors of male infertility. Acharya Charaka has described Shukra Janana Mahakashaya. Okay, so this is given to the patients in male infertility. All the drugs, the contents we'll be seeing later on. All the drugs are Guru Snigdha. So the concept of Vriddhi Samanehi Sarvesham Vipritere Vipareha Sarvada Sarva Bhavanam Samanya Vriddhi Karanam Rasetu Visheshasya Pravritir Ubhayasya Tu. That is Sarvada Sarva Bhavanam Samanyam Vriddhi Karanam. Based on this principle, drugs which are used in the Shukrakshay or oligospermia or the conditions related to semen or conditions related to Kshaya, that is Shukrakshaya, then this Shukra Janan Tela Basti is given. The drugs are Snigdha, Guru, Manda, Hima, Sthira. So again, they are having properties similar to the Shukra and Madhura Rasatma. Hence, according to the principle which I have mentioned above, it leads to increase in the Shukra Dhatu. Now, Shukra Shodhan Tel is again one of the medication which is used in our OPDs. Both indications of both the drugs are different. If there is more number of deformities or premature ejaculation or defective pathology, then we use Shukra Shodhan Tel. If there is deficiency, then we use Shukra Janan. So Shukra Shodhan Tel, mostly it has Katu Tikta Rasatmak Dravyas are used and Katu Tikta Vipak. Thereby it results in the improvement in the quality of the sperm. So when the quality needs to be improved upon, Shukra Shodhan Tel Basti is given. If the quantity is defective or if the quantity is less or deficit, then Shukra Janan is used. So these are the Ghatak Dravyas. These are, you can have a photo also. Shukra Janan Tela and a Shukra Shodhan Tel. So this procedure is also mentioned. So 3 liters of water, the above contents each with 30 gram, half liter. So it is to be Chaturthansha Kvat, as it is mentioned in the medicine preparation in our Sanhitas. Chaturthansha Kvata is prepared, and then tela is added, and then it is prepared. That according to the tela prakriya, it is prepared and then it is administered. So this is Shukra Janan Tel and this is Shukra Shodhan Tel. Kanchanara Gugulu Vati is used in the cystic conditions. We very well know Kanchanar is used in Ashmari. So wherever there are cystic lesions, anywhere in the reproductive tract, Kanchanara is given because we know that it is Kapha Shamak, it is Ushna Tikshna. So it has anti-tumor, anti-inflammatory properties and decongestant properties also. And hence it is very effective in the cystic conditions. So it is Kanchanar Gugul is widely used by Ayurvedic experts in many cystic conditions, including the defects of the thyroid gland. Kuberaksha Vati is also, there is a research project going on in our department about Kuberaksha Vati, use of Kuberaksha Vati in the polycystic ovarian conditions. So as we all know, it is again Kapha Shamak, and it helps to combat the Vikrut Meda Dhatu and helps in reducing the increased weight. So Kuberaksha Vati is used in PCOD conditions, other cystic conditions, and also in obesity. Kuberaksha Vati is used. So other kalpas which are used are Arogyavardhini. As I said, we use it as Dipan Pachan before Basti, before Vamana and Virechan. Arogyavardhini is given as Dipan Pachan, Am Pachan Dravya. And then Kanchanar Gugul in cystic conditions, Hingashtak is used in combination with Arogyavardhini. Kuberakshavati Sahachar Tel is used in different conditions wherein there is amenorrhea or scanty menses or painful menses. Bhadranimba Kulatha is used in conditions when the pathology is Kleda Pradhana or Kapha Pradhana Samprapti is there. There we use Bhadranimba Kulatha. Varunadi Kwat, Dashmul, Kumari Asav, depending on the cause again, these quats are used in patients. Kashmiri Kutaj Basti, as I already said, we've already discussed it. Kashmiri, Guru Guna and Brihana, it leads to growth of the follicles. Ushna Virya and Rechan Karma leads to rupture of the follicle, and thereby it gives a very good results in anovulatory cycles also. And in cases of ovarian, when the patient is going towards the ovarian failure, there also Kashmiri Kutaj Basti is given. So this is the infective pathology that I was talking about. Many a times we see patients coming in the OPD. Patients have gone through different, all sorts of investigations, including laparoscopy, hysteroscopies, HSDs and everything. But the infective pathology in the reproductive tract is not considered or not taken into account. And simple treatment of infections in such patients helps the patient to conceive. Even the pH alteration, for pH alteration, we give Kangshi Jala Yoni Dhavan. Even Kangshi Jala Yoni Dhavan has led the patients to conceive sometimes. So small things need to be taken into account while treating. So this is the infective pathology. It may be in the form of cervicitis, vaginitis, or erosions. So Yoni Pichu Dharan procedure, which we do. As I already said, the different kalpas are used according to the dosh pradhanya, dosh lakshanas. So this is the procedure of Yoni Pichu Dharan, which is done. Cervical erosion, Jatyadi Tel Yoni Pichu is used, facilitates the destruction of columnar epithelium and facilitates the growth of new healthy stratified squamous epithelium on ectocervix. So we have got very good results of Jatyaditil Yoni Pichu in case of cervical erosion. Yoni Dhavan procedure, these are the drugs. This is the Panchavalkal Kwat. This is the Yoni Dhavan procedure. This oil is used for lubrication, and sometimes basti is also done, and for that also this tail is used for lubrication process. Yoni Dhavan drugs, Trifla, Nyagrodh, Sphatik, Panchavalkal. Apamarga Kshar Pratisaran is another one of the procedure which is done. So this is the Apamarga Kshar videos we will see later on. This is the Pratisaran procedure. It is applied till 100 pala and then followed by Nimbu Swaras application. This is the Kshara. This is application of Kshara. So Apamarga Kshara Pratisaran, it is strongly alkaline and hygroscopic. See, when we do a particular procedure or when we prescribe a particular medicine, we should be utmost clear in our mind as to why this particular patient is subjected to this particular medicine or therapy. It's not just somebody is saying and something is mentioned in the text that we are subjecting the patient to this particular medicine or treatment. One should always know the rationale behind using the particular drug or the particular procedure. Only then we will be able to render success to the patient. Otherwise, just ask, because if I will tell you one thing, you will keep it in mind, you will note it down. But when you see the patient, there may be some sort of difference. So you should always be aware about the concepts of Ayurveda and be thorough in the clinical examination. Only then one particular guidance or something will be very useful for you. So it is of utmost importance that one should note or one should keep in mind before managing the patient. So Apamarga Kshara Pratisaran, why and how does it work? It is strongly alkaline and hygroscopic. It has a corrosive action, that is destruction of the columnar epithelium and epithelialization of the squamous epithelium. And why does this happen? It happens because of the Katu Tikta Ruksha Guna, Ruksha Tikshna and Ushna Viryatmak properties and Chedan properties. Because of that, Apamarga Kshara Pratisaran is useful in cervical erosion. Yonivarti or lep, Yonivarti is Nimbadi, Plaksha Churnavarti, Trifaladivarti, and Yoni Lepana. Yoni Lepana is useful in patients of vaginitis, strawberry-like appearance. Different types of vaginal infections are there, or sometimes there is a condition wherein you see that there is tenderness or dyspareunia of the patients. And in such case, Yoni Purana or Yoni Lepana is very useful. So painful coitus is one of the practical defects or the practical pathologies, I can say, we see in the patients where everything, all investigations are normal, but the coitus is painful and hence it doesn't come out to be really effective for conceiving. Hence, that condition is also very practical and hence it needs to be addressed very practically. Counseling also plays a very important role in such patients. Narrow introitus and dyspareunia are sometimes related. There is narrow introitus, because of that there is dyspareunia. So Yoni Purana or Yoni Pichu. Now the Pichu size also differs from patient to patient. If there is dyspareunia, narrow introitus, and if the Pichu size is big, then the patient will not cooperate. Hence, depending on the condition of the patient, introitus and everything, we need to decide the size of the pichu also. It is also very important. And the pichu, for any condition, if the pichu is used, it should not be kept for more than 2 hours. Better you keep the patient admitted in OPD or IPD for some time, and after removing only the patient should be discharged, because we have seen many patients coming up with the infected pichus. The doctor had advised them to remove, but the patient forgets it and then lands up in infections, slough discharge, and then one condition is not treated and the second pathology crops up. So small things we need to keep in mind while treating the patients with Sthanik Chikitsa also. This is the Plaksha Churna Varti, which was prepared in the topic was given to one of my PG students, and Plaksha Churna Varti was given in patients of uh, pathological leukorrhea. So this is the effect of apamarga kshara pratisaran before treatment and after treatment. So as I already said that we need to decide which dosha is the causative factor, which dosha is dominant in that particular pathology, and depending on that, the kalpas need to be used. Tankard is also used very frequently in the patients of cervical erosion. Local therapy, how does the local therapy has cause result for infertility? It helps by pH alteration, infection as the cause, and the role of basti. The basti also plays a very important role as a therapy. Sattvic ahar, meditation, and yogic practices, how does this help? It improves the mental health. It maintains the hormonal balance, reduces the oxidative stress. It maintains the couple harmony, and pranayam, exercise, and music therapy also contribute to mental health. Hence, this should always be advised to the patient of infertility. So this was an article which was published. This is the reference, and the conclusion they laid was yoga helps to reduce stress levels and help to increase the chances of conception. Yoga poses can help alleviate the stress-related reproductive tissues. Yoga may increase the physical adaptability, coordination, and the quality. The breathing exercises may calm the brain centers. Yoga can be effective complementary approach to managing unexplained female infertility, not only female, even in the male factors, this helps. Benefits of yoga on stress reduction, hormonal balance, and other aspects of reproductive health make it a promising intervention for outcomes improving fertility. This was the article. Now, what are the recent trends and how does the recent trend go in hand with Ayurveda? Means whatever the basic principles or the therapies which are advised by Ayurveda, how does they live up to the recent trends? This we will see. Now, the recent trends in the management of infertility is PRP treatment or the ovarian PRP treatment. So this is still in the experimental stage. Now, what is PRP treatment? The ovarian PRP is a plasma therapy where our own platelet-rich plasma is injected into the ovaries to rejuvenate the quantity of the eggs. So this is the ovarian PRP treatment. Now, we can say that this reference is already in our Sanhitas. How? Because in the previous slides, we had seen the Dhruvam Chaturnam Sannidhyat Garbhasyat with Rutu Kshetra Ambu Bija. So here comes the role of Bija Chikitsa. Bija Chikitsa. Now, how the Bij can be improved, the quality of Bija can be improved by Shodhana, that is Panchakarma Chikitsa. By Yoga Basti, we very frequently, and most of the patients which come to you are subjected to Yoga Basti Kram in our OPDs. Yoga Basti in the form of Tila Tel as Tela and Kwat in the form of Dashmul or Trifala. And in cases with patients are married for 10 years, 8 years, 5 years, still unable to conceive, then they are subjected to Vamana Virechan also. So to improving the quality of Bija, there is a Panchakarma is very important. So Shodhana Chikitsa, and before Shodhana, Deepan Pachan is very important. And once the doshas are Shodhita, that is once they are cleansed, they are maintained, then comes into role the Rasayan or the establishing the normalcy. That is after the Shodhana is there, then comes into play the Rasayana or the Shamana Dravyas. That is Gokshur, Shatapushpa, Shatavari, Falagrita, and Yashti Madhu. So this is how PRP treatment or ovarian PRP treatment different. It is nothing but to rejuvenate or the improve the quality of the eggs. So Ayurveda has an answer to it in the form of Bija Chikitsa. So ovarian reju, what does the Shodhana Chikitsa and the Shaman Chikitsa do? Ovarian rejuvenation in case of thin endometrial lining where PRP helps. in Ayurveda, we can combat it by Uttar Basti Chikitsa and some oral drugs like Lodra, which act on the uterine endometrium, poor ovarian reserves, and boosting the sperm production. So all this can be taken care of if we go with the principles of Bija Shuddhi or be improving the quality of Bija using Ayurvedic therapy. Second is the stem cell treatment. It is the cell therapy where stem cells are extracted and from the tissues or the bone marrows. Okay. Now, your doctor will extract the healthy stem cells and inject it in your body to replace the damaged cells. These cells are called totipotent stem cells as they have the magical properties to regrow and self-place themselves to the damaged part of the body. So post-Ayurveda therapy, there are various conditions such as IVF or ICSI, wherein the patient, there are some conditions wherein Ayurveda has also said that according to Sadhya Sadhyatva, the patient should be treated. So if the causes are asadhya and the patient has to go for a IVF, even then we cannot say that Ayurveda will not help now. The success rate of IVF is always controversial. It is not 100%. If the patient is subjected to Ayurvedic therapies, Panchakarma, and the principles and therapies that we have discussed before, then the success rate of IVF ICSIs have seen to be increased. Sometimes we have referrals from the IVF centers so that when the patients are having more number of attempts and still the IVF is not successful, the patient comes to our hospital for Ayurvedic therapy and we see them succeed in IVF therapy. So the post Ayurveda therapy, the success rate of such therapies also increases. Natural IVF cycle. It is called natural IVF cycle because it is more or less similar to the natural reproduction as the process is carried out without stimulating the ovaries. So again, here comes into play the role of Rutu and Bija Chikitsa. So Bija Chikitsa, Rutu Chikitsa in the form of various panchakarmas and various drugs can also help in improving the outcome of IVF. Embryoscope, this is, I have particularly mentioned these slides to just have a brush up of the recent trends which are followed these days. So embryoscopy is an interesting latest IVF technology. Okay, so here time-lapse incubator, which consists of a camera, is used. It allows uninterrupted viewing of the embryo development from the incubator and hence avoids exposing it to the outside conditions. After every 10 minutes, the embryoscope takes pictures. And then a small time-lapse movie is made and which is subjected to monitoring of the cell division. So basically, this is again to monitor the process of cell division. And as a result, the best embryos are selected by the embryologist for implantation. So again, this is the procedure of scopy, wherein they monitor the growth of the embryos and select the best quality embryos to increase the success rate of IVF. Pre-implantation genetic testing, PGS. Pre-implantation genetic screening and PGD both fall into the category of pre-implantation genetic testing. So this test screens the embryo for any kind of chromosomal abnormalities before transferring them into the uterus. PGS helps in improving improved embryo selection by determining the chromosome number of each embryo growing into the blastocyst stage. Next is the laser-assisted hatching. An embryo is surrounded by the protective shell called zona pellucida. So for successful implantation, this outer shell breaks out naturally, and in some cases, zona pellucida hardens it, making it difficult for the implantation process. So this IVF technology called laser-assisted hatching helps in the successful embryo implantation. I-womb technique is an intelligent womb technique for growing embryos in embryology lab. So what does this? The peculiarity is a particular temperature is maintained, the level of CO2 and humidity is maintained so as to facilitate the process. Vitrification, this is again one of the techniques is a rapid freezing of eggs, sperms, or embryos by adding cryoprotective agents such as salts, sugars, glycerol, etc. So as to minimize the DNA damage and avoid forming ice crystals. InvoCell or vagina incubator, it is again the latest IVF technology, intervaginal cultural device. So it creating the natural environment for the vagina for initial embryo development. Here we can see that they have laid emphasis on creating a suitable environment in the reproductive tract. So Ayurvedic answer can be in the form of bastis, what we do by yoni pichus or yoni lepana, or what we do as uttar basti or even yoni dhupana is what creating the favorable environment in the reproductive tract. Even male uttar basti is given in our setup, wherein we see the patients getting very good results. So all the sthanik chikitsas basically focus on increasing the conducive environment for fertility. Ozone sauna therapy, again, ozone is made up of 3 oxygen atoms, we know the. So ozone sauna technique helps the body to efficiently take in the oxygen and utilize the benefits. This is also based on the principle of creating conducive environment for fertilization. So Ayurveda, creating favorable environment in the reproductive tract in the form of yoni dhavan, uttar basti, pichu, dhupan, yoni lepana. What is ICSI? So what is ICSI? Once attached, the sperm, this is the picture of ICSI. The sperm pushes through the outer layer of inside of the egg, that is cytoplasm, where the fertilization takes place. Sometimes the sperm cannot penetrate the outer layer for different reasons. So the egg's outer layer may be thick or hard to penetrate. So because of which the sperm may be unable to swim. So ICSI can be done along with IVF to help fertilize the eggs. During ICSI, the single sperm is injected directly into the cytoplasm of the egg. This is the reference. So this is the IVF and this is ICSI. So this is the difference. These are the different stages. First is the ovarian stimulation, 9th to 11th day. Then egg retrieval. These are, and here is on the stage 4 is ICSI. Embryo transfer is done, and then cryopreservation is done, and this is how the procedure is accomplished. Now let us have a look into the success stories as to what treatments we had given and how the patient had conceived. So this was one patient having the complaint of irregular menses since 2 years. Now it is also pertinent to know the associated symptoms and the associated complaints of the patients. That gives you a picture about the dosha pradhanya and the prakriti of the patient. Depending on that, we can plan the therapy for the patient. So the menstrual history was 5 days, 3 to 4 months. It was irregular. The menses 2 pads per day and it was painless. So all routine investigations were done. Patient was subjected to Shatapushpa Tel Matra Basti for 8 days for 3 cycles. Now, most of the therapies or the therapies we plan for 3 cycle wise, 3 cycles, 6 cycles that way. Tablet Aloes compound was given and diet and exercise was explained to the patient. Now, this is the result of the patient. This is in front of you. After USG and before USG, you can see that the ovarian, there was change in the ovarian size and the volume also. And after, thereby leading to, now I have mentioned the cases depending on the cause of infertility. The cause was treated and accordingly the patient conceived. This is the same patient. This is the case paper of the patient. You can see that Shatapushpa Tel Basti was given to the patient and the medicines were given. This is the USG report of the patient before treatment and after treatment. This is the simple ovarian cyst patient having amenorrhea, irregular menses, and these were the associated symptoms USG suggested of simple ovarian cyst. She had an irregular menstrual pattern. And then this was the treatment which was given to the patient. Initially, Primolute was given for the menses to come. Whatever therapy or whatever Panchakarma therapy we give to the patient, it is always after menses. It has always to be given after menses. So as she was having amenorrhea 2 months, a withdrawal was given, and then Kanchanar Gugulu and other medicine was given to the patient, and you can see the result. This is the patient's paper. This is before and after USG. This was again hemorrhagic ovarian cyst. In hemorrhagic ovarian cyst, we give medicines which are Pitta Shamak also. Mostly Guduchi, Nimba, Manjishta, Khadir, Kwat was given for Niruha. Daru Haritra Ghanavati is given. And Moktik Kamduda was given for 7 days. And Gugul Tikta Kashaya was given 40 SFBD. That is around 20 ml was given to the patient. And we had success in this patient also. This is the case paper of the patient. Primary infertility and the patient conceived. This is again patient was there with secondary infertility. Pushpa Dhanvaras Narsimha Rasayan was given. This was a male patient, and this was a therapy, and then you can see the result. Asthenoazoospermia, this patient was asthenoazoospermia, and you can see the difference in the semen analysis reports after the therapy. An ovulatory cycle patient with PCOS. This was the medicine which was given, the management of this patient. And again, the patient was successful in, there was reduction in the signs and symptoms of PCOS, and the patient conceived. This is again an ovulatory cycle patient, before and after reports. This is again the patient who was anxious for child, but she was having infection. As I said, that infection should always be ruled out before treating the patient. This was the management medicines which were given to the patient, and this patient conceived as well. Secondary infertility patient. Patient conceived. So these are some of the studies which are published based on the principles of Ayurvedic management. This was the study published regarding the tube block. We have also seen patients in our OPD which have come with different histories and all. And once they were diagnosed with the tube block. And after Uttar Basti, the blockage was cleared up and the patient had conceived. So for the management of tube block or unexplained infertility, I would always recommend to practice or the subject the patient to Uttar Basti. Now, Uttar Basti should also be given after Yoga Basti Kram, or at least 2 or 3 sittings of Basti. After Basti, only Uttar Basti should be given. In the patients wherein there are history of many operative procedures or different adhesions are there, in such patients also we can very easily give Yoga Basti Kram to the patient, and the inflammatory changes and abdominal discomfort, pain, and different complications or the symptoms related to the adhesions are also seen to be relieved using Yoga Basti and drugs such as Arogyavardhini, Kamdudha, Shankhavati. So these drugs can be given, and the addition related complaints of the patients can be relieved. So this was again one of the articles which I got to see, management of female infertility by Ayurveda. So this was from NIA Jaipur. So to summarize, infertility, Ayurvedic aspects need assessment of infertility we have seen. Ayurvedic principles we have discussed, the incidence and etiology we have discussed. Also some modern aspects have been discussed, pathological factors, investigations, principles of management, diagnosis, management of infertility as per Ayurveda. Then we have also seen the recent trends of infertility, success stories we have seen. Now, if time permits, I would like to show you some of the videos of Sthanik Chikitsa which we are routinely doing in our setup. Uh, may I have the permission of the organizers? Can I show small videos?
Yes, ma'am. With pleasure, ma'am.
Yes, okay. Is the screen visible?
Not yet, ma'am. The screen is not visible.
Is it visible now?
No, ma'am. It's not visible.
Okay, wait.
The
Yeah,
screen is visible now, ma'am.
okay, yeah. So this is the Pichu Dharan video. These are the instruments which are used for Pichu Dharan. This is the speculum. This is the AVR, anterior vaginal wall retractor, sponge holding forceps. This is the tail which is used. This is bala tail. This is the pichu. As I always said that this pichu should always have some part which can be left behind. It can be removed from outside and should not be left in the vagina for more than 2 hours. So these are the instruments which are used. This is how the pichu is should be generously soaked in the oil. Otherwise, the pichu itself can cause irritation in the vaginal wall or the cervix. So it should be liberally soaked in the oil and then it should be gently inserted. Size of the pichu differs from patient to patient depending on the condition for which it is used. This is general liberally soaked pichu. You can see this is the pichu. And it is with all aseptic precautions. The pichu should be autoclaved, it should be sterile. The drug also should not be used unless it is autoclaved. All the instruments and everything should be autoclaved. And then you can see that it is gradually inserted inside. Before that, the patient should be explained about the procedure, what procedure she is getting subjected to. Proper consent of the patient should be taken. And only then the procedure should be. Even sthanik chikitsa, the patient's consent and explaining proper procedure and side effects to the patient is very, very important. So after 2 hours, the pichu should be removed. Properly, it should be inserted. And then it can be, see, you can see this is kept outside so that the patient can remove it herself. Or if you are keeping the patient in observation, you can get it removed on your own. This is another video I'll show. This is Kshar Pratisaran. Hope it's visible clearly.
No, ma'am. The video is not visible, ma'am.
Okay. This is Kshar Pratisaran. Now it is visible?
The screen is visible, ma'am.
Yeah. So this is Apamarga Kshar Pratisaran. You can see these are the materials which are used. This is Kshara.
Ma'am, but the video is not visible, ma'am. The screen alone is visible.
Now it is visible?
Yes, ma'am. It is visible, ma'am.
Yeah. So these are the materials which are used. This is the sterile gauze pieces which are used. This is the gauze which is folded. Then this is the sponge holding forceps. Preferably for this Sanic Chikitsas, Cusco speculum should be used so as to have a proper view of the part which is subjected to therapy. This is sterile gloves used, and this is the tray. The everything, as I would like to emphasize that it should be properly autoclaved, it should be sterile with all aseptic precautions. This therapy should be done. Otherwise, instead of causing effect, it will lead to complications in the patients. It will lead to direct infection in the reproductive tract. Hence, it is of utmost importance to do all aseptic precautions. This is the infective cervix, which is visible. See, when we use this Cusco speculum, you have a proper insight of the organ which should be subjected to therapy. Plus, when you use Kshara, the surrounding places should be kept absolutely guarded. Because sometimes when we use Kshara, the tissues which are normal, if you apply Kshara, they are subjected to get irritated. Hence, only the part which is eroded or which is having pathology, that should be subjected to Kshara Pratisaran. So this is the proper view of the cervix. This is the Kshara which is used, which is caught hold in the sponge holding forceps. And then this is applied to the cervix. Application of Apamarga Kshara for 100 matras. Application of Apamarga Kshara, you can see that it is applied on the affected area only. Now here most of the area of the cervix is affected. So we didn't guard it. Otherwise, the surrounding part should be guarded with the normal gauze. Now this is the Nimbus Swaras, which is applied after Kshara Pratisaran. Application of Nimbus Swaras. Now we have another video. This is Uttarprasthi procedure. So first we are preparing the part, that is cleaning the externals. External genitals should be cleaned properly. Then we are filling up this drug. It is again balatel, which is properly autoclaved first. And the sterile disposable syringe is used. Filling up of drug in the syringe, you can see 5 ml. 5 to 6 ml, because some of the drug is likely to get wasted when we remove the air from the infant feeding tube. Now, what else? We can use infant feeding tube or artificial insemination cannula. Either of the two can be used, because the material of this particular instrument is not causing any type of injury to the cervix or the uterus from inside. Hence, it is better to use infant feeding tube or the artificial insemination cannula. See, you can see this infant feeding tube is attached to the syringe and the air is removed. It is very important to remove air. So until the drug comes out, a little bit of drug is discarded, and then this should be inserted inside the cervix. See, this is a caught hold now. To have a proper grip of the infant feeding tube, it doesn't go here and there. It to keep it fixed, it is this sponge holding forceps is used, and using this first cusco speculum is attached. After that, we can see this cervix when os. This infant feeding tube is inserted. Now, when we use this sponge holding forceps, we have a proper grip, so that doesn't slip off. Hence, it is very important to use. If you are using artificial insemination cannula, then this instrument is not required. See, this is the proper view of the os. You can see this getting inserted inside the internal os. So this is the infant feeding tube gone inside the external os. It should go beyond the internal os, and then gently you should push the drug inside the uterine cavity. See. This is the proper position. See, this is the proper position. See, this is the proper position of the infant feeding tube inside the uterine, inside the os. Now, this is a very safe instrument, hence it doesn't cause any injury to the cervix or the uterine wall. See, gently you're supposed to push in the drug inside the uterine cavity, otherwise the patient may land up in vasovagal. So it is very important to push very gently. Two to 3 cc goes inside, the remaining is spilled out. Then you can remove the instrument, give a pichu, and then ask the patient to rest in leg raise position so that it facilitates the entry of drug into the uterine cavity. Thank you.
Thank you, ma'am. Thank you very much, ma'am, for the insights and guidance that you have provided on your experience on managing the infertility. We'll now go ahead to the question and answer session. Shall we begin, ma'am?
Yes, most welcome.
Yes, ma'am. Delegates, please post your questions in the chat box. There are few questions. Delegates, you can post your questions in the chat box.
I think I can see 2 questions in the chat box.
Yes, ma'am. I'll read it out, ma'am.
Yes, yes.
The first question is how to prepare Kangshi Jala for Prakshalana, ma'am.
Yes, so Kangshi gel preparation is very simple. Here, what we need to be cautious is the water should be boiled properly, and then to 1 liter of water, you can add around 5 gram of Kangshi to it, 5 to 10 gram of Kangshi, and then this Kangshi can be used for Yoni Dhavan. Yoni Dhavan, and sometimes this Kangshi gel can be used for Pichu Dharan also. If you are using it for some cervical pathology, then you can use as Pichu, or for Yoni Dhavan, you can use the entire 1 liter or 900 ml of Kangshi gel.
Okay, ma'am. Thank you, ma'am. Moving on to the next question, ma'am. For Apamarga Pradisarana, any Purva Karma and Paschat Karma to be done, ma'am?
Yes, for Apamarga Kshar, Purva Karma includes firstly explaining the proper procedure to the patient. Now explaining means you should also explain why this procedure, the patient is subjected to this procedure, what result is expected, what are the possible side effects, and what will be the effect of this therapy. Now, before the pre-procedure, one should always go for bowel and bladder evacuation of the patient, explaining everything in detail to the patient. And you should always rule out diabetes or any systemic conditions. Because what happens if the patient is having diabetes or any other condition, it may lead to no response of therapy. So firstly, ruling out the systemic causes, ruling out other conditions, and doing HIV, VDRL, all the investigations, bowel and bladder evacuation, and proper aseptic precautions of the drug and also of the instruments which are to be used. That is Paschat Karma also she has asked. So Paschat Karma means you should always monitor, because sometimes while applying Kshara, the patient has immense pain. She complains of severe pain. So you should always keep some analgesics also ready. And if it is too much of painful, then you can anyways apply, remove the Kshara, stop the Kshara Pratisaran and apply Shatadod Ghruta or any other Ghruta so as to relax the patient and reduce the pain. Paschat karma wise also, patient needs to be kept in your observation for 1 hour or so. And if at all required, some analgesics can be given if required. And again, I would like to emphasize that systemic conditions should be ruled, because we have seen many patients wherein the patients didn't give the history of any systemic condition. And when there was no response, it was seen that the blood sugar level was raised and the patient was of uncontrolled diabetes. So she was not having any relief. So it is very important to have the systemic condition of the patient in front of you, even for Sthanik Chikitsa.
Okay, ma'am. Thank you, ma'am. Moving on to the next question, ma'am. The question is not just the instruments, even Tyla is also autoclaved, ma'am.
Yes, it has to be autoclaved. When you get the packed piece, then for the first time it is not required. Otherwise, whenever you keep the instruments and the linens for autoclaved, you should always keep the drug also for getting it autoclaved.
Okay, ma'am. Thank you, ma'am. Moving on to the next question, ma'am. Ma'am, could you, this a question differed from the topic. Could you please say about single umbilical artery in pregnancy, ma'am?
Actually, in ANC, there is entirely a different lecture can be given for such conditions. But we don't treat the patient as single umbilical artery or any such condition. We usually treat the patient for supraja, that is uh, healthy progeny. So in that context, if we have anything, a complication or any defect in the pregnancy, then we treat the patient according to Garbhini Paricharya, and different kalpas are used in such patients. Now, if the patient has not conceived or has the previous history of such conditions, we do again the same Shodhana Chikitsa and the Bija Shuddhi Chikitsa, and the different treatment protocols are followed, and then the patient is allowed to conceive, and proper Garbhini Paricharya is given in such patients.
Okay, ma'am. Thank you, ma'am. Moving on to the next question, ma'am. How the shape has been provided to Plaksha Churnavarti and what is the weight, ma'am?
Yeah, weight is around 10 to 15 gram is the weight, and the shape is provided by using madhu, honey is used.
Okay, ma'am. Thank you, ma'am. Moving on to the next question, ma'am. What can be the line of treatment for a patient with multiple fibroid and torch positive with cervical infection? Can Kshara be applied in such cases, ma'am?
For cervical infection, if it is erosion, as I always say, and in this session also, I had reiterated that one should always keep in mind the pathology, that is which dosha is pradhan and what type of pathology is there. There cannot be one treatment protocol for n number of cervical infections. It differs from patient to patient, from pathology to pathology. So, as you said, for multiple fibroid, there is another treatment which can be in the form of some gugulus, which can be given. Uttar Basti should be given with very cautious caution. I mean, if it is multiple fibroid, what is the size of the fibroid? Where the fibroid is located? Either it is in the myometrium or it is somewhere outside. Depending on that, the therapy varies. Torch infection has to be dealt with completely differently. Torch infection, if it is torch positive, what pathology in torch is positive, whether it is IgG positive, whether it is toxoplasma, whether it is herpes, what type of torch positivity is there, depending on that the treatment varies. Cervical infection, as I already said, it depends from patient to patient, whether it is erosion, whether it is monilial vaginitis, whether it is cervicitis, what type of infection is there. Depending on that the treatment varies, but definitely we can treat such patients effectively.
Okay, ma'am. Thank you, ma'am. Moving on to the next question, ma'am. What is the duration of treatment in Sthanik Chikitsa, ma'am?
Duration also varies. Now, if the patient is subjected to Uttar Basti, it can be for 3 cycles, not more than that. Three times in a cycle. In a cycle, you can give the Uttar Basti for continuous 3 days or alternate day for 3 sittings. For 3 cycles can be given at the most, not more than that, because then you are anyways it is an intrauterine procedure, so it is subjected to infection and different invasive complications. So that way, usually we give for 3 cycles, not more than 3 to 5 days per cycle.
Thank you, ma'am. The next question is the treatment for hypothyroidism in Ayurveda during pregnancy as well as diabetes mellitus during pregnancy, ma'am.
Same thing. Firstly, if it is diagnosed early before pregnancy, then it has to be subjected to different therapies, panchakarmas, and various other medicines according to Ayurveda. And then after conception, if it is diagnosed, then you have to follow the Garbhini Paricharya regimen. As per, we can see Garbhapala Ras or Vasanta Kalpa can be given in such patients, but again, it differs from patient to patient. But we have used these drugs in many patients, Garbhapal Ras and Vasanta Kalpa, Swarna Malini, Madhu Malini, and Lagu Malini Kalpa.
Thank you, ma'am. The next question is in Shveda Pradhara, there is pain in lower abdomen and low back, and it is due to the excessive kapha kleda, but you said that pain is due to vada. How can we rule out it, ma'am?
Yes, see, pain is also different types of pain is there. If it is kapha pradhan, the property of kapha is not Vedana. In Vata, the primary guna of Vata is Vedana, Todavat Vegna. So what we see in patients is primarily if the patient is coming with intense pain, then we see the symptoms of Vata in such patients. And that way also, you should always treat the patient in chronological order. Whichever complaint is more, the treatment should be according to that. So in Kapha Bahul Pradhan ya Kapha Bahul pathology, we see more of clather, more of discharge, more of itching, heaviness, and hypertrophy of the cervix. But if it is more of Vata Pradhan, there is Tanu, Strava, and Vedana is more in such patients. Kapha is not concerned with Vedana. It is Kleda in Kapha, Gaurava, Kleda, and Kandu in Kapha, whereas in Vata, it is Tanu, Strava, and Vedana. Vedana is common in Vata and Pitta both, actually.
Thank you, ma'am. The next question is can Triphala dispersible tablet used for douching, ma'am?
No, we have not used actually Trifla tablet because I am not sure how it is, whether it is completely dissolving in water or what. I don't know. We have anyways used Bharad, Trifla Bharad for douching. And one more thing, in account to the previous question, one pathology is not a single doshaj. It is always in combination. So one should always keep in mind that if you suspect it a vata pathology, it cannot be completely vata. There is some part of kapha dushti, some part of pitta dushti also. So according to that, which is dominant, you should keep in mind. But you should not think that there is only one dosha which is dominant. It is always dvidoshaj or tridoshaj. Yes, please.
Okay, ma'am. Thank you, ma'am. I think that's all for the questions, ma'am. Shall we
Okay.
wind up the session, ma'am?
Yes, yes, sure. So I would also again like to thank the organizers and the host and everyone present for being present in this webinar, and also for arranging and for giving me this opportunity to deliver my talk on this prestigious platform. Thank you very much.
Thank you, ma'am. It was really informative session along with videos which made the class more live, and it was very beneficial for our practice, ma'am. Thank you all for your patient listening and valuable time spent. To know more about our updates, please do stay connected with our social media platforms. Dear Diksha students, a Google rating link has been shared in the chat box. Please click and post your valuable comments, feedback, and reviews about our platform. We would love to hear from you how our platform is helping you to mold your profession and excel in clinic. Education is not the filling of a pail, but the lighting of a fire. William Butler Yeats. Thus, we are winding up our today's session, hoping each of our classes are beneficious to our growing phase of knowledge, with a lot of new information for us to close our eyes with thought-provoking knowledge. Thank you all for joining us. Thank you, ma'am. Thank you, participants.